carpal tunnel syndrome can be operated or treated with a small scar with the help of nanoscopy. If you're able to take this camera under the transverse carpal ligament, under guidance, the small incision, we can just have to push in a small blade and cut the transverse carpal ligament from below upward under the vision of the camera, such that you don't require a bigger incision. Treatment of carpal tunnel syndrome varies from injection techniques, splinting to open surgeries. That's a basic treatment option for a carpal tunnel syndrome if it's severe. Hello everyone, I am Dr. Gopinath Duraiswamy, Clinical Lead Senior Consultant Orthopedic Surgeon from Chennai. Today we are going to see about an interesting topic about the common condition or commonest condition what we encounter in your wrist joint. There are many instances, most of the middle-aged women or men will start experiencing an excruciating pain in the wrist joint for unknown reason. It might be for a post-pregnancy, it might be in terms of menopause, it can be middle-aged person. The symptoms is such that the patient might be experiencing quite an excruciating pain in the 3 fingers radiating from below upward. So usually they feel some numbness, tingling, clumsy sensation, limiting the activities of gripping and activities of daily living. So we consider this might be a carpal tunnel syndrome. So carpal tunnel syndrome is a commonest condition where a nerve which is called median nerve gets compressed at the level of your wrist joint for various reasons. There are many systemic conditions reasoning for a carpal tunnel syndrome, which might be a thyroid disorder, it can be a recent weight gain, it can be a metabolic disorders, and obesity can also be reason. As I said, carpal tunnel syndrome is a compression of a medial nerve and the aftermath of it. So treatment of carpal tunnel syndrome varies from injection techniques, splinting to open surgeries. Till date, the severity of carpal tunnel syndrome will dictate the surgery, and most of the time, most surgeons will do an open release of the carpal tunnel syndrome, where basically you should understand the underlying pathology is compression of a nerve. So here the treatment is to decompress the nerve or remove the factors which are compressing the nerve. That's a basic treatment option for a carpal tunnel syndrome if it's severe. For a moderate or a mild carpal tunnel syndrome, we can treat the patient with the conservative measures or even by some injection techniques. So today we are going to talk about severe carpal tunnel syndrome where surgery is mandatory. So till date, the treatment for severe carpal tunnel syndrome is open surgery, but nanoscopy, which I've already told is a latest advancement in technology, has created ways to many minimal invasive procedure. With that advancement, now carpal tunnel syndrome can be operated or treated with a small scar with the help of nanoscopy. So it is a revolutionary step in the field of orthopedics to treat carpal tunnel syndrome. So to understand this technique, open carpal tunnel release and a nanoscopic assisted carpal tunnel release, usually an open carpal tunnel release will require such a big incision from this particular point till this area where you have to open up and look for the transverse carpal ligament, which is usually compressing the median nerve. So it's a kind of a fibrous band on top of the nerve. So to release this band, we need to explore completely and then cut the transverse carpal ligament. So eventually require quite a long 4 to 5 centimeter incision, and nowadays over due course of time we try to reduce incision as well, but still it is an open procedure. But with the advent of nanoscope, you can see the camera is so small enough with a high precision, high definition camera. If you're able to take this camera under the transverse carpal ligament, under guidance, the small incision, we can just have to push in a small blade and cut the transverse carpal ligament from below upward under the vision of the camera, such that you don't require a bigger incision. So here all you require is a small transverse incision here at the level of this joint, such that it can allow this camera to go inside all the way below the transverse carpal ligament. So under vision of this transverse carpal under this nanoscopy, you just have to insinuate a specialized blade which can go and cut the transverse carpal ligament. If the transverse carpal ligament is released, it will relieve all the compression causes over the median nerve, and the carpal tunnel syndrome is relieved and treated. So in such a way that this carpal tunnel syndrome can now be treated by nanoscopy. This is a recent advancement and the latest technology the patient can be benefited from. Thank you.